Hi, good afternoon. Dr. Gary here. Dr. Gary on the road. Dental practices for sale. We are dental practice brokers. The name of our company is Healthcare Practice Sales LLC. We've been selling dental practices for 11 years, and I was a dentist for 25 years. We now have 8 employees. We actually have 4 marketing individuals out finding new practices for sale and helping us assist sell the dental practices also. Plus our 2 CPA accountants, a marketing director, copywriter, and a graphic artist. So we're busy and rolling every day. The information you're about to hear is for entertainment purposes. This is not business or legal advice. Our phone number is 201-663-0935. 201-663-0935. Thank you. Our website is dentalpracticeguide.com. dentalpracticeguide.com, 201-663-0935. We try to bring you current information, things that happen within the last 48 hours. We're about to tell you a story about the most difficult practice to sell. But we try to give you that live information, live from the front, what's happening today. We're different than these other brokers out there because we're on this 363 days a year, and we take off Christmas and Easter. We're in about 16 states right now. We're growing. Right now we're growing into Tennessee, Massachusetts, Maine. And then after that, perhaps it'll be Kentucky, Ohio, I'm not sure yet. But we continue to grow, continue to make things happen for you. The videos we make, it's when we have free time to make them. We're not making them as one of these suit guys in the studio with the monitors and the plants and the special lighting and sound systems. Just don't have time for that right now. So I hope you'll accept these videos, YouTube videos from the car. It's when we have free time that we try to do it. But if you want the suit guys, I guess they're out there. That's just not us. I'm trying to tell you what happened yesterday. So hold on a minute, and I'm about to tell you a seller that called me. And so he calls me yesterday. So I would entitle this YouTube as one of the most difficult dental practice to sell. Attention sellers, this is the most difficult dental practice to sell. And that is, he calls me yesterday. He says, I want to sell my practice immediately. I stopped practicing 10 days ago. I said, 10 days ago? He says, yeah, I'm not seeing any more patients. I want to sell the practice immediately. And I've already moved into my vacation home, 1,500 miles away. I'm like, whoa, you're not giving us much to work with, no, a little time. I mean, what kind of lease do you have? And you're not coming back. If you're not coming back, this is going to be a record sale. That's all that it is a record sale, because you're not even in the space. The staff is not there. This is the most difficult practice to sell, one that has closed up already, and the seller has moved out of the state. And this happened a week and a half ago. I'm like, what am I supposed to do? I want to help him out. In 2019, they grossed about $250,000. This is an urban area that he's in. Maybe a second floor, very cheap rent. And I asked him, what about rent? He says, well, I'll pay it for a little while longer, maybe another month. So I think this is going to be a record sale, but he will not travel with the records. There was no hygienist. Family members worked in the practice. They're not available. It's like, it's going to be hard to find a buyer. The only buyers that may take it are ones that want to pay based on the income that comes in. Because this is like, it's good that he just closed and he's calling me now, better rather than waiting 3 months or 4 months or 5 months. But this is going to be very challenging. We will do the best we can and to try to put this together. But I'm not sure. I just don't know what's going to happen in this situation. I am like, I don't know. We'll have to just keep up. We're going to market it right away. We're going to call a few doctors that I know that may be in that area that may want to pick up a record sale. And it's very difficult to figure out price. How do you figure out a price of a doctor that's not going to stay with the practice? There's minimal goodwill. We have no staff, and we have a facility that is inexpensive rent, but he's only been on a month to month. So he's not any pressure. He could just close that up any minute. I don't know if the new buyer is going to want to take over the space because he's not there. And it's reasonable, but it's on a second floor. Makes it even more difficult. So you have a limited amount of visibility. So I don't know what will happen, but what we must do right now is advertise, call people we know. Fortunately, we've been in this business long enough. We know enough people that we can call on short notice that might pick it up. But the valuations, I don't know what's going to happen with the valuation because the goodwill's going down the tubes, and he's already left a week and a half ago and closed up the practice. I said to him, you just can't leave and walk away. You have a responsibility to the patients. You've got to maintain their records because they're going to be calling for the records. You've got to answer the phone calls. If you're going to leave, you have to send a letter out that you are closing the practice. The records will be available, and they have, they're going to have to find a new dentist. I don't think this is the way to go, but that is your responsibility. You just can't close the door and walk away like a shoe shop. Well, I'm all done and I've had a great life and nobody wants to buy the business, so I'm just going to close up the shoe shop. But even then, people have their shoes in there. So you just can't walk away. That's the worst thing to do, is to walk away from a dental practice, because you walk away, those patients scatter. They want their records, and you got to maintain them for about 7 years, depending on statute of limitations and so forth. So you got to maintain the records for 7 years. And he's going to have to keep the phone number going because those patients are going to be calling up for records. He's far better off selling it inexpensive. What he can get for it, I don't know. A record sale where you're not there, I just have to guess, maybe 19-20% of 1 year's gross. That's just a rough number. And I'm not sure what's going to happen here. What is he going to do if he doesn't sell and he's throwing this on my lap now? We'll do the best we can to sell it. We use all our resources to sell it. But we say again, this is the most difficult practice to sell. The ones you walk away, just close up the door and tell somebody else to sell it. It's challenging. But we'll do what we can. We'll help them out. But you never can walk away totally from a practice, think you can close the door and walk. Can't do that. You've got to hang in there for a little while, or bring an associate in, or provide them with another doctor, or just tell them you will not be practicing. They have to find another doctor, but you've got to give them, I think it's 30 to 45 days, depending on state statute. And you may have some cases that are work in progress. You got to finish. You can't leave people hanging. So this is what I'm up to. This happened yesterday. This is news breaking from the front. This is what we have to deal with all the time. But we're here to help you, and let's stay in touch. Thank you. Bye.